on what we do whenever our case is delayed or bumped or even canceled, but you want to save it for another potential case that may come through and we're still able to use it without wasting everything, because we are able to use this and have it covered, and it's good for 8 hours until we actually have to take it down the whole back table. So this is our Z-Drape. It's only for the back table. We have another one for our Mayo stand. And I'm going to show you how to drape this out sterilely while it's good to sit back there until time to start the case. So we're going to come over here, and most of the time these aren't on the cards. We have to ask our nurse for them or call for them, and we're just going to open them whether you've already broke scrub and you're just moving on your patient, or if the nurse told you you're still scrubbed in, she can go get it. You're just going to open it to your back table. So when you're all scrubbed in, you open the package. Depending on your experience, there is directions on how you're supposed to Z-drape it, but we're just going to throw this away. And then when your nurse gives it to you, you're going to want to open it to where you can see the number 1, and then there's number 2, and then you're going to pop these because you're going to want it to cover your whole table. You're going to flip it over until you see the line, because this is the perforated line where one person's going to rip and the other person's going to rip it off in order to have your back table back. And you're just going to put it over the edge. You're going to put this other side over the edge. And you really want to be careful with your instruments that are hanging off your pan if you stand them up, so it doesn't rip and tear or get caught on the drape as you pull it apart. And then you're going to open this side. And then you're going to open this side. And you're just going to let it hang off of your back table. And you should be good until your case gets started again, and or you have to rip it down because it's maxed out on the 8 hours. And on your drape, there is a setup time, AM, PM, and a date. So right now it's 8:25 at night. So we're going to do 8:25, and we're going to check PM. And then today's date is 10/8/2025. And then this is either going to be good for the rest of your shift or for the next person to come in here, depending on what time your shift ends. And then that's it, and you're good and you're able to break, but you want to make sure you have on your gown and gloves, not just open gloves, because you don't want your arms over your back table as you're draping. Thank you.